Are you or someone you know struggling with pain during or after pregnancy? The fix could be easier than you think. In this week's Ask the Expert series, 7 News' Kelsey O'Donnell spoke with a doctor at Bon Secours St. Francis about ways to ease the pain.
Orthopedic issues are a hassle to deal with when trying to take care of a baby.
It definitely is rough being a new mom. There's a lot to it, a lot before and after. It's a very tough thing on the body.
Dr. Laura Cook, an orthopedic physician with Bon Secours St. Francis, says pain during or after pregnancy is not uncommon.
We see a lot of low back pain in orthopedic practice amongst various populations. And in terms of pelvic pain with women, sacroiliac joint issues, pubic symphysis issues, I'm actually coming across that quite a bit, either in pregnancy or postpartum.
And while Dr. Cook says these pelvic joint issues are painful, the remedies can be simple.
Our management, thankfully, is not operative. It doesn't require surgery. A lot of women would benefit significantly from a good physical therapy program. And something that I would encourage women to reach out to their doctor about or reach out to us about is actually seeing a pelvic floor physical therapist.
Dr. Cook says home remedies like pillow support, heat, and Epsom salt baths can help. But if pain persists, see your doctor.
There's a condition that I have seen, although very infrequently, in women who have hip pain called transient osteoporosis of the hip. And it's actually a condition where, unfortunately, we have to put women on a non-weight-bearing status using crutches.
Mothers can have pain in other parts of the body as well.
A couple other common conditions that we see in the postpartum phase of lifting babies routinely is something called de Quervain's tenosynovitis. The common term for that is actually called mother's thumb because moms are frequently lifting a baby, and so it's tendonitis in the thumb.
Dr. Cook recognizes the challenge of being a mom, but says a good support system can go a long way.
I think when we are new moms and having a baby, it's a team effort. And so if the spouse can support that new mother of giving them the time to do their therapy routine, especially if they are limited in what lifting they can do post-operatively, of providing support of doing that manual labor and making sure that they're getting adequate rest in that initial postpartum period as well. That's really important. And it's tough when you're now raising and taking care of another life, but you got to take care of yourself as well.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
If you'd like to submit a health topic, head to WSPA.com, then click Ask the Expert.